My name is Ian Batanda, a senior orthopedic officer and also the palliative care focal person at Fort Portal Referral Hospital. My presentation today is going to be about improving palliative care data collection at Fort Portal Referral Hospital. So I'd like to start with a brief background. Before 2019, there was no Ministry of Health data on palliative care from Fort Portal Referral Hospital. At that time, the national database only had just one indicator, and that was pain requiring palliative care. And currently, it is still the only indicator present in the HMIS 108, and it is actually still absent in the HMIS 105. HMIS 108 is the outpatient report on palliative care, while the HMIS 105 is the inpatient report. And as you can see, this single indicator is inadequate for reporting on palliative care, and therefore inadequate for informing, for providing data that can inform the improvement of palliative care at Fort Portal Referral Hospital. So in 2019, the Palliative Care Association of Uganda, working with the Ministry of Health, introduced mHealth. mHealth is a strategy that uses a mobile application to collect data. Our objective of introducing mHealth was to improve data collection about palliative care within the hospital, and also to facilitate the compilation and submission of a comprehensive report which would then inform improvement. A little bit more about mHealth. mHealth is a term used for the practice of medicine and public health using mobile devices. So in our case, we use a mobile app called ODK, which is an open source application with a customizable questionnaire. It comes with a questionnaire that you can customize to suit the needs of your data collection. Now, what this ODK has done for us is that it has eased data collection and submission of reports to the Palliative Care Association of Uganda, because it is easy to use and because we use it on our own mobile devices, so it's cost effective. Currently, the Ministry of Health and the Palliative Care Association of Uganda have also developed an OPD register. This register is specific for collecting palliative care data, so that we can then have further improvement in the data collected, and also to fast track the integration of palliative care in the services that are provided at the Fort Portal Referral Hospital. So how have we benefited from the data collection? The reports we collect have helped us generate data that has identified and highlighted the number of patients needing palliative care. So we have identified a steadily rising number of patients needing palliative care, and we have been able to do that because of the reports that we collect, thanks to the data collection tool that we use. In addition, this data has helped us to lobby for morphine supplies. Without the data, we were struggling to convince the national medical stores to supply us with morphine, and so the data helped us to lobby with more evidence. The report also helped us to identify areas which needed reinforcement, and one of the areas we identified was gaps among the healthcare workers, especially regarding knowledge about palliative care and exactly what palliative care is about and who needs to participate. And so with the data we collected, we were able to identify the people that we need to talk to get them involved in palliative care and to support the palliative care service at the hospital. And one of the key people we identified were the hospital administrators and heads of various departments. But most importantly, these reports have highlighted the growing number of patients needing palliative care. And that alone, highlighting the number of people needing palliative care, has enabled us to lobby for more resources and to make more networks and collaborations with other people that are willing to offer assistance. This slide is showing a graph of some of the data that we have been collecting from 2018 to 2019. The graph in blue represents the number of patients that we have been seeing that have been receiving specialist palliative care, patients who have been attended to by a specialist palliative care provider. And then the graph in green represents the amount of green morphine that has been consumed. The graph in pink represents the pink morphine that has been consumed. And the graph in red represents the number of children who have accessed specialist palliative care at Fort Portal Referral Hospital. From 2018, you can see that there's a progressive increase of patients accessing palliative care. In 2018-2019, we had only 78 patients. That increased to 288 patients in 2019-2020 and 317 patients in 2019. At that time, we had only green morphine, but thanks to the data we were collecting, we were able to increase the number of morphine that were being supplied by the national medical stores. And in 2018-2019, we had a consumption of 336 bottles of green morphine. The following year, 2019-2020, the consumption improved to from 336 to 521 bottles, and then in 2021 to 590 bottles. You can see that there's a progressive increase in the number of people accessing palliative care, and therefore the morphine consumption is also increasing. At that time, 2018-2019, we didn't have red morphine, but in 2020, we were able to convince the national medical stores to give us red morphine because we were able to present data, and so that is one of the things that we benefited from the data we collected. The slide here with me shows the commonest illnesses that we have been attending to at the palliative care unit in Fort Portal Referral Hospital. The commonest are cancers. We have many other illnesses, including sickle cell disease, but almost 70% of the patients that we see at Fort Portal Referral Hospital palliative care unit are cancer patients. Now, what does that mean to me? It means that the cancer burden is on the rise in the region, and I believe that this data also reflects what might be happening in other referral hospitals. That means that we cannot afford to leave the fight against cancer to the Uganda Cancer Institute alone. We need to take deliberate steps to relieve the increasing crowds of cancer patients that happen to crowd every day at the Cancer Institute. And one of the things that we can do is to start oncology units at the different referral hospitals. In order to do that, we need to get the young doctors, nurses, and clinical officers, even those who are still in school, we need to get them on board. We need to make them interested in oncology and palliative care. But we also need to find training opportunities for them and then get them interested in working in the referral hospitals. By doing that, we shall be able to bring the cancer care services closer to the people and also relieve the Uganda Cancer Institute from the increasing burden of cancer disease. Thank you very much.